ask you, what are the diseases that are actually caused by obesity on one's body condition, and also what are the treatments that are available?
Hello, I am Dr. Sibasis. I work as a specialist general and bariatric surgery in Aster Royal Hospital. We have an excellent team here which covers the comprehensive bariatric surgery program here. I work with Dr. Khalid, who is a consultant bariatric surgeon, Dr. Rakesh, who is also a consultant bariatric surgeon, Dr. Safia, who is also a consultant bariatric surgeon. We have a team also who is supporting us as an endocrinologist, Dr. Wasim. We have a full-time diabetic specialist dietitian is there. Now coming to the question what you asked, basically we divide them as per the BMI. Less than under 18 BMI is underweight, 18 to 25 is normal weight, and 25 to 30 is overweight, and more than 30, which is 30 to 35 BMI, is considered as obesity class 1 or category 1. 35 to 40 is considered as obesity category 2, and more than 30 we call them as category 3 or morbid obesity. So why this category? Because we have a classified treatment for each group. Probably the 18 to 25 groups are very blessed, they don't need any treatment, they just have to maintain it. More than 25 up to 30, they probably need some kind of diet programs, some kind of exercise programs, supervised, unsupervised, either way they can be helped. More than 30 BMI onwards, they need some kind of intervention, either a medical intervention or some kind of minimal invasive interventions. And as per the WHO guidelines, more than 40 we offer them without any comorbidity. We can offer them a surgical program like sleeve gastrectomy or bypass, which our Dr. Rakesh will elaborate in briefly. Now between 30 to 35 we have got medical management, or we can offer them as some kind of balloons or minimal invasive, which is reversible. Like whenever we stop those programs, like how that supposing somebody is taking some injections or tablets, if they stop it, they can regain back the weight. But we help them temporarily so that they can reduce certain amount of weight and they can maintain it. And obviously, if somebody is having more than 40 BMI, they definitely have to go for surgery, because most of the time the amount of weight loss what is required for them is too high for them to manage with either a diet program or exercise program. They cannot usually reduce that much amount of weight by alone any program. So they need some kind of surgical intervention.
So now again, let's go back to the same thing where I asked you about the conditions. So what does one feel when you speak about these 3 different levels of obesity? How is their body condition?
Yes, so to understand that, we need to understand what obesity causes. Obesity causes gamuts of diseases, like we can say more than 200 conditions of diseases which can be caused by obesity. It can be in the simple form of hypertension, it can be simple form of cardiac diseases, it can be osteoarthritis, it can be sleep apnea, it can causes secondary amenorrhea, it can causes fatty livers. Many diseases are caused. Similarly, when somebody is obese, they may have difficulty in walking long distances, they may have some breathing issues, they may have, when they sleep in the night, they may snore. So obviously in the daytime they will be sleepy. If somebody is trying for pregnancy, they may not get the pregnancy. If somebody is having a thyroid issue, they may feel lethargic, they may gain abnormal weights. So it is a multifactorial conditions which happens, and multiple symptoms they present with.
And how do you select? So suppose, say, as you mentioned again, obese second level or second stage, you usually recommend them for certain treatments. And when you do that, what is it that first you look for? Do you look for age factor, gender factor, or anything else, like have they been through treatments before, or of course, their background?
See, initially we categorize them as per the very simple formula called BMI, body mass index, which is a weight in kg divided by height in meter square. Their height in meter in two factors upon which is weight in the kg. In that, as I said, we do a very simple categorization: less than 18, 18 to 25, 20 to 35, 20 to 30, 30 to 35, 35 to 40, and more than 40. Apart from that, we take many other factors into our consideration. Supposingly somebody has a hyperlipidemia, cholesterol is increased, or blood pressure is increased, or cardiac disease is there, or osteoarthritis is there, OSA is there. All these factors, when it is there, we actually consider to reduce the BMI for the surgery. as factor 5. Like if supposedly somebody is normally a candidate for surgery who is more than 40, we reduce up to 35 and we consider them in Asian population up to 32.5 also we consider them for the surgical candidates. So if anybody is having any comorbidity, we definitely consider them for the surgical candidate as an early stage, because once the complication sets in, it is very difficult to reverse. Like suppose somebody gets into type 2 diabetes or the complication of it, the complication is very difficult to reverse. So when we have the time, it is the best time to utilize it. In Aster, we have the Center of Excellence for General and Laparoscopic Surgery. Out of that, we have the Center of Excellence for Bariatric Surgery specially, with all dedicated doctors, endocrinologists, dietitians, and with in-body analysis of your BMI, everything. So come visit us in Aster. We'll take care of your journey throughout. Thank you.